Hi, it's Peter Leone. I'm an infectious disease physician with the University of North Carolina. I've been there for 25 years. Extensive career in public health, ran an STD or sexually transmitted infection clinic for 12 years, and was the medical director for HIV and STDs for the state of North Carolina for an additional 12 years. I'm here to talk about HPV, cancers that are related to HPV for the American Sexual Health Association as part of their National Cervical Cancer Coalition program. So we have a series of questions. We'll run through those, and I look forward to the interactions with you.
What is HPV?
So first question is, what is HPV? HPV stands for human papillomavirus. So it is a virus that is transmitted through contact, skin-to-skin contact. In this case, we're talking about genital or oral or anal contact. So it's a virus. There are over 200 subtypes that are numbered. So we go from 1 over to 200. Not all of those cause any diseases. In fact, some of them don't really do much of anything. Your immune system handles it. Most HPV infections are actually handled by the immune system, cleared, and don't result in disease. Obviously, the concern is, what are the diseases that we can see with it? There are two subtypes, HPV 6 and 11, that are associated with genital warts. The other subtypes that we worry about are those that are high risk that can cause cancer. There's two in particular, HPV 16 and 18, that account for about 70% of cervical anal cancers. There are another 5 subtypes that make up about 20% more of cervical cancers.
What types of cancers are associated with HPV?
You really have to think about it in terms of anatomy. There's the head and neck, the mouth, and the upper part of the throat. HPV causes about a third of those cancers. It can also cause cancers, though, of the vagina and the vulva. In men, it can cause penile cancers, less so for men who are circumcised, but it also can cause anal cancer, and that's true for both men and women. Important point here is that your anus is part of your sexual organs. You don't have to have penetrative anal sex in order to get HPV infection.
What does it mean when I've been told I have high-risk HPV? High risk for what exactly?
So high-risk HPV subtypes are those that are associated with the risk of developing cancer, cervical cancer, anal cancer, penile cancer, head and neck cancer. That doesn't mean, though, that if you have a high-risk HPV strain that you will develop cancer. In fact, the majority of people who have high-risk HPV don't. They clear it. The reason why high-risk HPV types are associated with cancer is the fact that they tend to persist. And they persist because the DNA of those high-risk types insert themselves into your cell's DNA. And when they do that, your body doesn't see it, doesn't clear it, and it can take over the cell's machinery. And once it does that, you begin to get abnormal growth of those cells that can lead to cancer. The low-risk types for cancer don't insert themselves into the host DNA.
I have HPV that will not clear. What does that mean?
So a couple of things on this. I'm not entirely sure what it means to have an HPV infection that doesn't clear. What I'm presuming is that this is a person who may have gone in and had DNA testing where they do a swab to look for HPV, and maybe it's been there and been persistent over time. And the reason that's a concern is that with the high-risk strains, they tend to actually persist for longer periods of time in the body. But I do want to make a point here is that the majority of HPV infections actually clear. So although about 70 or 80% of us, humans, will acquire HPV over the course of our lifetime, about 70% of HPV infections clear within 2 years of acquiring it, and 90% clear within 5 years. So even though the majority of us get infected, in fact, I like to think of it as a marker for being sexually active. If you've ever been sexually active, you've probably picked up HPV. But most of the time, nothing happens. You clear it or your body contains it. What we're trying to prevent are the diseases associated with it.
I got a pap test. The doctor told me that the test was abnormal and they found aggressive viruses. She told me to come back in 3 months for a follow-up PAP. Is there any reason to get an HPV test too?
This individual had been recommended to come back in within 3 months for another PAP test. I personally wouldn't recommend that. I think actually this is a great time to actually do HPV DNA testing to look at whether or not they have high-risk types that are associated with cancer. Because if they don't, then the pap smear itself can be interpreted differently, and there wouldn't be anything really more aggressive or more intentional in terms of follow-up. If they do have a high-risk type, then that means that this person needs to be followed, and in some cases there will be a recommendation to do what we call colposcopy, where a physician will actually look at the cervix through a magnification process to look for changes that are associated with HPV infection, and will biopsy those areas specifically to come up with a diagnosis. So you have a larger sample of cells that a pathologist can look at and then decide whether or not anything else needs to be done.
My wife and I have been in a sexually monogamous relationship for over 19 years. My wife was recently diagnosed with HPV. I got tested for all STIs a few years ago and didn't have any. Could I still be the one who gave it to her?
First of all, I'm not the sex police, and STI testing should not be used as a forensic test to decide from whom one infection was transmitted or acquired. Life's complicated, and these pathogens or viruses are not so straightforward. In the case of HPV, men generally aren't tested for HPV. It's a visual exam. So when you've been told as a man that you've been tested, or even for women, for all STIs, sexually transmitted infections, you need to find out what tests were actually done. Not just what was done, but what wasn't done. And for men, HPV is really a visual exam unless we're doing anal cytology screening in high-risk individuals for anal cancer. So I don't think he was tested for HPV. But to backtrack, what about his wife? Well, she may have gotten HPV from him early in the relationship, being he could have been a carrier of HPV infection and didn't know it. She may have had it from before. It certainly doesn't imply that anyone's been outside of the relationship.
I tested positive for HPV-16. I've been in a monogamous relationship for many years. Can I assume my partner has it, and we don't have to worry about reinfecting each other back and forth?
This question I've been asked a lot about ping-ponging HPV infection. Most of the transmission, in fact, about half of the transmission of HPV infection from one person to the next occurs within the first 6 months of a sexual relationship. So if you're changing partners frequently, within 2 to 3 months, there's a high probability you've acquired HPV from them. Once you've acquired a subtype of HPV, it's thought that you probably won't reacquire it. So you may persist with that. If your body clears it, you probably have immunity to that particular subtype. Unfortunately, with HPV, protection from one subtype doesn't translate into prevention against all other subtypes, which is why we recommend having the vaccination with Gardasil 9. We want to make sure you're covered for these other subtypes that are circulating. And it's an important point to come back to. So for this partnership, have fun having sex.
I've had HPV in the past. Is it risky for my partner to go down on me?
We like to use fancy words like fellatio and cunnilingus. Most people think it's an Italian meal that you order. It could be, if that's your kind of thing. But blowjobs, oral sex, all of that. Great stuff. Should do it. Should have fun with it. In the case of HPV, sure, there's a risk of transmission that's there. But as I've mentioned, most HPV infections result in nothing. Your body handles it or clears it. But it's a concern if someone's been diagnosed before. By having a blowjob, could you transmit HPV from penis to throat, or from throat to penis, or from mouth to vagina, or mouth to anus? Yes, it's a concern, which is why we do all the screenings that we talked about. But I would come back to vaccination. Get vaccinated. If you're under the age of 45, even if you've been diagnosed with HPV, get vaccinated. You can prevent transmission or acquisition of those other strains that you haven't had.
I'm over the age of 45. Can I still get the HPV vaccine?
The answer is yes. If you're sexually active, especially if you're changing partners or your partner's changing partners, I would get vaccinated. Your insurance company won't probably approve that, so you'll have to pay out of pocket. But personally, it prevents you from actually developing cancer. It can prevent you from developing warts. The risk for cancer, depending on how long you live, won't go away, especially with new acquisition of partners, means you're getting exposed to possibly new strains of HPV. So we talk about HPV vaccination for folks under the age of 45 because that's where the studies have been done. That's what the government has recommended, which means insurance companies will cover that. Over the age of 45, there's no contraindication for that. We believe that they work. You have to pay for it, but the alternatives, I personally would get vaccinated over the age of 45, especially if you're changing partners.
I was diagnosed 7 months ago with high-risk HPV on my cervix. I'm currently dating a man who likes me and wants to be with me, but is completely terrified of catching HPV. He's even worried about French kissing. I've seen mixed messages on the internet. Can kissing be dangerous? Is there a test for HPV of the throat?
So, lots to unpack here. If they've never had sex, then certainly there's a risk for him acquiring it from her. But unless he's a virgin, he probably already had HPV infection. So I think one of the things to think about is if you've been sexually active for a while and you've had more than a single partner, probably had HPV. Secondly, yes, there's a concern about transmission, but as we've said earlier, most HPV infections result in nothing. So I wouldn't let that interfere with the desire to have sex with someone who you really care about and want to have a fulfilled sexual life. Coming back again, the role of HPV vaccination. If you're really concerned about it, get vaccinated. That vaccine will protect you. Coming back to French kissing. Deep kissing certainly can result in HPV transmission, but unless you don't want to kiss anybody in your entire life, I really wouldn't worry about it. Go in, see your dentist for your dental cleaning. They'll do a nice, quick oral examination for anything that you're concerned about.
I am a 32-year-old healthy female. I am being treated for a recurrence of HPV. The first infection was about 6 years ago, and I had laser therapy. My doctor thinks this is a new strain and not a recurrence of the old infection. Do you agree? If it is a recurrence, does that mean it's more likely for me to get cancer?
You can have recurrences that aren't new strains, but actually old strains that are persistent. So that old 16 is still there, and those cells eventually progress into precancerous and then cancerous changes, which is why we continue to do screening. Without the HPV DNA test, however, we may not be able to know what strains this person initially had. So to answer the question more specifically, I don't know whether this is a persistent old HPV strain that she had, which is what I think is likely the case, with just sort of recurrences, which can happen, or whether she acquired a new strain from somewhere else, someone else, that now is resulting in changes.
What's the difference between Pap tests and HPV tests?
We sort of developed the standard for doing visual exams, then removing cells through a swab that's sent to pathologists to look at before we actually had sort of the technology of being able to screen for DNA. We didn't understand all the subtypes that were associated with HPV-related cancers, but we have that diagnostic test. But the history of this was Pap smears first, which is a cytology test. Then we had the technology to look at picking up HPV itself. We understood what subtypes were there, what were associated with cancer, and now we had a way of differentiating things that were low risk or no risk for cancer versus those subtypes that were associated with cancer through the DNA. We want to be able to put those two things together, which is kind of where we're at right now for cervical screening for cancer and anal screening for cancer, where we do cytology and then we do HPV testing. Those tests can be done more easily. They're not as invasive. They can be scaled up pretty quickly and turned over quickly, meaning it doesn't require a pathologist to look at them. So I think in the next few years, we're going to be seeing changes and recommendations in how we use these two different tests. The problem is that we have sites like the throat and the shaft of the penis in which we don't have HPV screening tests that are available. That might change over time as well.
I'm over 65. My doctor tells me I don't need any cervical cancer screening anymore, but that makes me nervous. Should I keep getting tested?
Most HPV transmission occurs in individuals in their late teens, early 20s, when people become sexually active. So the risk of acquisition really has to do with the pool of people that you're having sex with. We see lots of HPV in young individuals because they're very sexually active, they change partners, and as a result, acquisition goes up. Over time, we tend to have fewer partners, and so the risk of acquisition goes down over time. And as you get to be 65 or older, your risk of new acquisition or time to develop cancer certainly would go down, but it's not zero. So my take would be, if you've been screened, followed, in the case of a woman, had negative HPV pap tests over 5 years or had negative HPV subtype screening over several years, then from 65 up, you don't need to continue to be screened for cervical cancer.
I'm in my 20s and never got the HPV vaccine, but I've had sex. Everyone says I've probably already gotten HPV. Does it still make sense to get the shot?
I would get vaccinated even at the age of 20. If you've had HPV, you might still be at risk for other subtypes. The vaccine will protect you from those that cause cancer. 90% of them are covered by the vaccine, and will reduce or prevent you from acquiring genital warts. Once you're sexually active, you probably will acquire HPV, which is why we would recommend getting vaccinated or having your kids vaccinated before they become sexually active. The recommendations now are to consider vaccination of children starting at the age of 9 to 11. And the reason for that is it's a preventive vaccine. The best benefit of the vaccine is to get it before you ever acquire any HPV infection.
Is the HPV vaccine for everyone?
If you never plan on having sex again and you don't have HPV, then probably the vaccine's not for you. But we're talking about the full spectrum of people, both genders, any orientation, men, women, cis men, trans men, cis women, trans women. Get vaccinated. You'll protect yourself, reduce the risk of head and neck cancer, cervical cancer, anal cancer, penile cancer, no warts. It's a good deal.
I got the vaccine. Is there anything else I should do to prevent HPV?
An important risk factor, though, for all of these in terms of causing cancer with these subtypes that are associated with it has to do with your own lifestyle. So smoking, tobacco, increases the risk of developing cervical and anal cancer as well as head and neck cancers. So we recommend reducing or not smoking as a way of reducing that risk. Excessive alcohol intake can also increase the risk of developing cancers due to HPV in the throat and mouth. And then your immune status. So if you're someone who's had an organ transplant with your immune system suppressed, or with folks with HIV infection that's impacted their immune system, we can see an increased risk of developing cancer over time due to these high-risk HPV strains.
Where should I get information about HPV and cancer?
I think I would go to reputable sources of information. Now, if you're on here seeing this, then you already understand that the American Sexual Health Association provides up-to-date information. I would start there. Dig down into information you can find out about HPV, ways that you can protect yourself. It's a good place to start. CDC also has a website with good information, as well as the National Institutes of Health. So go to reputable sites, look for information, Feel free to question. You deserve to get good information, and if you're unsure about it, continue to question the sources.